very closely with the State Department of Health to continue to investigate any possible cases based off of these new cases that we're announcing today. So as we have said before, when we have a new confirmed case, we have disease investigators who begin a contact investigation, and they go through the contacts of the person who is confirmed positive. Where do they work? If they have children, where do they go to school? How do they get to work? Have they traveled on mass transit recently? So that if we have others who are deemed at risk, who are close contacts with these positive cases, we will contact them directly and let them know how to proceed. I had the opportunity to tour Northwell Health Labs early this morning in Lake Success. They came online to test a couple of days ago, and they're going to be announcing soon that they're ramping up more expedited testing. We do know that the more we test, it's very likely the more positive cases that we will have. So I really need to emphasize right now that panic and stress do not help us solve problems. We want to make sure that we're giving the public the facts. So I think it's time for us all to take a deep breath, maybe take some breaks from social media, and arm yourself with the facts. And I think the most important fact, the most empowering fact, is that containing community spread is vital. We're doing that through our contact investigations. We have a health department that is 200 strong and has been doing an outstanding job working around the clock. We have a very well-prepared Office of Emergency Management that has the right kinds of trucks and vehicles for transporting people should we need that. Our school districts, and we have 56 school districts here in Nassau County, along with a lot of private schools. They are all preparing for tele-teaching should the need arise. We've heard announcements about some school closures, especially in connection to the 2 school bus drivers who tested positive that we spoke about yesterday. All 80, the families of all of the 80 children who, by the way, who rode those buses have been contacted. So we're doing everything we can. Our IT department, the police department, OEM, health department, of course, the communications office is doing everything we can to get the word out about what we're doing and how we're partnering with our local, other municipal leaders, our towns, our villages, our cities, working with the state, and of course with the federal government. I also want to tell everyone what you can do. I don't know, you could probably repeat this along with me right now, but if you're not feeling well, stay home. Don't go to the doctor. Don't walk into the walk-in urgent care. Call if you're feeling ill, if you have shortness of breath, cough, fever. If you have symptoms, please call. We're not shaking hands right now. It's not impolite. It's just the right thing to do right now. We want to make sure that people aren't taking advantage of this panic and the stress and the anxiety right now. And so we have a very robust Office of Consumer Affairs that is really clamping down and doing investigations. So we announced 2 violations yesterday. This morning we're announcing 7 additional violations, and a total of 15 price gouging investigations are happening as we speak. A couple, I'll give you an example of some of the new ones that we're talking about this morning, some of the new 7 violations. Convenience store in Carl Place was fined $5,000 for selling Purell at a too high price, at a very high price. Gas station in Great Neck fined $5,000 for selling $3 hand sanitizer for $10 each. A card store in Hicksville was fined $5,000 for selling 7-Eleven branded hand sanitizer for $13, a small bottle. Manhasset Pharmacy and Variety Store was fined $10,000 for selling hand sanitizer at a highly inflated price. Syosset Card Store fined $5,000 for selling masks individually, and these should not be sold individually. You don't know who's touched them, for about $16 each. And a Wantagh convenience store was fined $5,000, again, for selling masks individually and not collecting the sales tax on them. Again, to report price gouging to us, to our Office of Consumer Affairs, email pricegouging@nassaucountiny.gov, and Greg May and his team will be on top of it. So the main thing we want to talk about today, shifting gears, is about schools. I have kids in public school, in a middle school and a high school. I understand the concern that parents have firsthand. I hear it from my neighbors as well. As you know, there have been several school districts, private schools as well, colleges and universities that have temporarily closed this week. This is not to cause panic. This is to contain the virus, as we are talking about, to prevent community spread as best as we and as best as the school districts can. We continue to work closely with our school districts to assure our students and faculty and staff members are safe. Yesterday, we announced that the 2 new positive cases were bus drivers. We've already covered that for both public and private schools, and those schools decided to close temporarily. There is a collaborative effort in the decision to close a school between the school districts or the private school, the Nassau County Department of Health, and the New York State Department of Health to make decisions on how to proceed. So if there is a link between a positive test and any of our school buildings, this collaborative effort happens to then provide guidance on how to proceed. Many of the schools that have temporarily closed in Nassau County are independently making that decision because of connections to a positive case, and that is absolutely their prerogative. They can do that. And if they feel that is the right thing to do, then they absolutely should do that. Our school representatives who are here now will discuss more protocol and precautions that they are taking, including plans for continuity of education if a district or a college has to close for an extended period of time. Teleteaching, for instance, I know my kids in our school district, our local school district, teachers are taking a survey of the kids, asking if they have a connection to Wi-Fi, if they have a proper kind of device, and making sure everyone's connected to Google Classroom. That's just one example of many. We are hoping that all of these measures will just be having to be taken under an abundance of caution, and we want to reassure everyone who lives in Nassau County, who teaches in Nassau County, who goes to school in Nassau County, that we're doing everything possible and beyond to make sure that we are safe, and our kids are safe, and our teachers are safe, and our school janitors and school nurses, that everyone remains as safe as possible to contain the spread of coronavirus. Most important, take care of yourself. If you're not feeling well, we love you, but please stay home. We'll see you when you get better. Thank you very much, and I would like to now turn it over to our educators to speak. So this is Bob Dillon from BOCES.
Good morning. I'd just like to assure everyone, as Laura said, that we're doing everything in the school community. Our superintendents, our leadership at the building levels have stepped up. We're deep cleaning buildings. We're sanitizing buildings. We're also planning for the continuity of instruction. We at BOCES have tremendous technical capacity with the internet. We will be meeting, we have met, we will continue to meet with our district leaders to share with them what we're doing and how we can increase their capacity or provide the capacity so they can deliver instruction to our students. Thank you very much.
Thank you.
Can you all identify yourselves as you speak, please?
Bob Dillon, District Superintendent, Nassau BOCES.
Jermaine Williams, President, Nassau Community College. Good morning. Thank you, County Executive, for inviting us to participate this morning. Thank you for Commissioner of Department of Health. You've been extremely helpful with your guidance. As we are all aware, the COVID-19 situation is ever evolving and causing an abundance of concern throughout the country and definitely right here in Nassau County. Among our NCAC community, our students, faculty, and staff are our #1 priority, and we've been extensively monitoring this rapidly evolving COVID-19 situation. Staying in close communication with our county and state officials and updating the NCC community regularly through emails and a dedicated page on our website. Upon notification from the Department of Health yesterday that we had our first confirmed positive association with the virus, we made the decision to close the campus through Wednesday, March 11th, today, in order to clean the campus according to appropriate guidelines. Face-to-face classes are suspended through the end of this week, Friday the 13th. Online classes will continue, and staff have been asked to return to the campus tomorrow upon the completion of the cleaning. All buildings on the campus will be thoroughly cleaned following Center for Disease Control guidelines and utilizing the Environmental Protection Agency registered disinfectant. Additional detail will be paid to specific locations where we know the positive individual has visited. In addition, we have chosen to postpone and/or cancel certain NCC-sponsored events or campus gatherings through April and an abundance of caution. As you can imagine, events are a fabric of our institution, and a lot of hard work and time is spent in producing these gatherings. However, to continue to ensure the health and safety of our NCC community, this step needed to be taken. Our executive and incident command teams have been in extensive contingency efforts to ensure business and educational continuity in the event that the campus needs to move operations remote for a prolonged period of time. We will continue to work closely with the county executive's office, state officials to assess the college, college's COVID-19 situation and determine when we can resume normal operations. We are thankful for the external and internal partnerships with union leaders and other college constituencies as we forge forward, knowing that health and safety is our paramount concern. We will take whatever measures necessary to ensure their safety and health. Thank you all for your time.
Thank you very much, Dr. Williams, and I want to thank you and your college's cooperation with my administration and with Dr. Larry Eisenstein, our Commissioner of Health, and his entire team, and also with BOCES and our other school districts. The communication between our institutions is incredibly important, so I'm grateful for that. Dr. Bill Johnson from Rockville Center School District.
Thank you, Laura. Just very briefly, I think I want to emphasize a few points. One, this is a community problem, and what you must understand is how closely we have been working with both the county and the county health department in fact, containing the problems that we have within our school district. Just to follow up on a few things that Bob Dillon had mentioned just a few moments ago, we're looking at this in terms of layers, and at the very beginning of this, what we need to do is have two priorities. The first is safety, the second is education. On the issue of safety, when in fact anything in our school district would suggest that we have either a student or a faculty member or a member of our staff who has in fact been identified positively, we have gotten guidance from the state that we will close immediately. The purpose of that closure immediately for 24 hours is to do two things. One of them is to clean our buildings, and the second is to conduct an investigation with the health department. We're also preparing for long-term plans. There is a possibility that we may end up closing for 2 weeks or more, and in the event that we're doing that, what we have done is work with our teachers, work with our principals and our administrators on putting together plans that enable us to provide electronic connections with our families in the community. We are putting together and assembling all of the instruments that they would need at home. We are also working on things that I never really thought of before, things like hotspots. Not everybody in our community or in the communities in Nassau County have access to Wi-Fi, so what we need to do is to figure out ways in which we enable them to connect with us and maintain that continuity of learning. So you need to know that most of the teachers in Nassau County have been provided time within their school districts to work with their administrators on assembling either units of instruction or lessons that can either be sent home in envelopes and in folders, or in fact, as in our case, will in all probability be sent home as part of a plan for utilizing, in our case, we're going to be using iPads. What's interesting is that there are many things. We don't have to reinvent the wheel on this. As some of you may or may not know, you can go on YouTube. You can access things like the Khan Academy. And many of our teachers, rather than in fact being encouraged to try to develop lessons on their own, to visit the websites, find things that would be compatible with what they're doing in the classroom, utilize things effectively to provide some continuity of instruction, some continuity of learning. So I could go into lots more detail. I may if you would like to ask questions, but at this point, you need to know and have confidence that the school district in Nassau County understand the dimensions of this problem, are working with our county leaders and, in fact, with our health department in resolving this issue, and we're very confident that the children, although it may not be exactly the education that you can expect, will have some degree of continuity of instruction in their family, with their families and in their homes. Thank you very much.
Thank you very much, Dr. Johnson. Would you like to speak? Yeah? Dr. Quincham from Freeport Schools.
So, good morning, everyone. Thank you for having us here. Most certainly, echo with everything that has been said, not to repeat things that have been already said. That's on our minds, and the schools are ready for anything that we have in front of us. The first thing I want to really talk about is really rumors. I think that something is happening. I can just tell you, like even last night in Freeport, there was a rumor about a situation that we had to deal with. So what I would urge everyone, not only, of course, Freeport, but whoever is hearing, listening to us, to really exercise responsibility relating to rumors, social media, and verify facts, information from verified sources, reach out to the schools for appropriate information. So I urge the parents, students to exercise caution in times like this and seek the right information from right people. So I'd like to say something beyond. Dr. Johnson started talking about e-learning. That's something we have been doing for a long period of time. Most districts across the state, now, like your safety plans, where you do a lot of tabletop exercises, this time is allowing for our e-learning plan to be tested, be effective. So a few things I might want to touch on is really, I know it's being done by a lot of districts, but including Freeport, we are creating a resource sites on our websites where students can go to log in to all the digital resources that they already have access to, but you're going to find one place for them to have all those resources that can that are currently supporting our instructional plan and currently supporting the learning of our students. So we are going to make that made available in one single place. And as Dr. Johnson said, our district certainly is ready, and we have over 6,000 Chromebooks that our students have. Already the Google Classrooms are in place, but now just the location is going to be changing. Instead of being in the schools, teachers, other support staff working with our students remotely. We are testing in all the login credentials, important information regarding the programs. Staff is working sure, and again, I'm repeating a few things. Yes, those who may not have internet connection or a computer, or somebody not having their electrical cords for their computers, those things are all being ironed out. There's tons of digital resources that we have, and we're very confident in the event of short-term closing or long-term closing. Most certainly learning will continue, and I'm also very happy to say that the entire staff, not only in Freeport, in other districts, are concerned and willing to work with all of us to provide that continuity of learning and education from wherever they are. And those conversations continue, and we're taking every day that's available, every hour that we have, to make sure whatever gaps we have in order to address the concerns that we have, they are being very effectively addressed. Thank you.
Thank you very much, Dr. Kuncham. I would like to underscore what he said about rumors. Rumors are flying fast and furious in the schoolyard, in the social media world. Don't believe everything that you hear. Oftentimes it's not true. So we want to do our best. That's why we're doing these daily briefings, just to get you the information, to get you the numbers as we're getting them. So thank you. I want to really thank our educational leaders for taking time. I know you're very busy right now, but for taking time to inform the public. We're grateful that you came, and we're grateful for what you do every day for our kids. Happy to take any questions you might have.
I just want to verify those numbers for Talmadge. Those are the towns of Hempstead, town of Elizabeth Bay, and town of North Hempstead, right?
Yes, yes. Did I not say that? Yes, 20, yep. Those are the actual towns, right?
This may be more of a question for the health commissioner, but what
shortage?
My understanding now is that we have the capacity to test what we need to, and the capacity is growing all the time. We were very excited that Northwell got approval with the help of the state and the support of County Executive Curran to push the FDA to provide them approval. And we even hear that commercial labs may be going online very shortly. So far, we're not in a position where we have heard of a backlog where there's a lot of people who need to be tested that are not. And I do want to re-emphasize that there's still a criteria for testing. And if somebody does meet the criteria to be tested, they're going to be put in a mandatory quarantine until that test result comes back. We don't want frivolous testing. There needs to be a suspicion for it. And at this point, we have not heard that there's an inability to do that. I don't know how many there are, but I know we're meeting the demand right now.
Out of the 25 patients, is anyone in critical condition?
I believe there is one, and we'll get you an update on that, and that's a more of a recent occurrence, and the overwhelming majority of them are doing well.
Are all 25 at the hospital?
No, it's split up. I don't know, and I want to inform you that the latest number that came in, it was at 19, happened as we were already here, so haven't actually reviewed the charts yet. We're going to really take the time to investigate them and get you that answer. The overwhelming majority of them are not hospitalized. I can tell you of the 19 that we had coming into this morning, 6 were hospitalized, the rest were not.
And the one that is in critical today, the age of that patient, gender?
I don't know. This is a recent occurrence. Yeah, somebody on the street who says, I want to be tested, there has to be a reason for them to be tested. And so the criteria has evolved and changed very quickly, very often. And so recently, the idea was to allow physicians in the community to start making the decision on who can and can't be tested. But the state gave the physicians very clear and strict guidance on what qualifies. So what we don't want is just random people going in and perhaps backlogging a lab. The issue may not be how many test kits there are, it could be how many can a lab process. And right now, it's Northwell and it's Wadsworth at Albany. The state laboratory is called Wadsworth in Albany. Until we have more labs and more capacity, that's going to be the bigger issue. And I know Northwell was talking about how with each day they're growing their capacity, growing the medium and all of that. So I'm not the lab expert, but as of now, people who the medical community has felt should be tested, we've been able to keep up with that.
As for social distancing, do you think at this time schools altogether should be closed for a period of time? And anybody can take that question.
That's a medical question.
All right, I'll give you the medical view on that first. So we really are looking at it on a case-by-case basis. And first, let me share some good news, because with these stories, there's a lot of fear and there's a lot of panic. A couple of days ago, I did a literature search and reached out to some colleagues, and there are no, and this is great news, important for you to know, no documented cases of pediatric deaths from coronavirus anywhere yet. Now, might that happen? Might we find more as more cases happen? I'm not saying it will never happen, but it's really good news that children are doing well, and that's very different than some other viruses like the flu, which we know can be very dangerous. So the thing about social distancing is you really have to weigh the risks and the benefits. You have to look at the evidence. One of the challenges with closing schools is, okay, now the kids are not at school, but where are they? And are parents home to take care of them? What's the impact if a parent can't go to work? And are parents going to be able to stay just home with their kid? Or are there going to be play dates and trips to the movies and the mall? Well, at that point, the exposure is beyond even just the school district. But so there is a lot to think about. And social distancing is a very important strategy for preventing the spread of disease. The worst thing that could happen is we keep kids home from school and then they go spend the day at grandma's house and could potentially bring the virus to them. So social distancing has to be done with guidance and correctly for it to be effective. Certainly, the key piece of social distancing is for people who are at risk to avoid risk. And so people who know that they are at risk should start thinking about what they're exposing themselves to. And that's a slightly different message, and we've been talking about it. But as it comes to schools, we're working with the schools to make a proper decision. And might there come a point when something broader has to happen? Maybe. But as one of the superintendents mentioned before, it is a layered approach.
You know, to reiterate what Laura said too, we're trying to avoid panic, and this is going to sound a little bit like an oxymoron, create a climate of normalcy in this abnormal situation. It's uncharted waters, but as I said earlier, we have great teachers, great leaders, and we're working on this and planning and preparing for what we have to do. The idea of childcare is very important. The idea of nutrition is very important. Many of the students who come to our schools, the only meals they get may be the breakfast and lunch that we provide. So I know there's some direction in the state plan, but again, the practicality of it is still in question. But we're looking to create as normal environment as we possibly can, given the fluid situation that seems to change on an hourly, if not an hourly basis, certainly day by day. 2 weeks ago was certainly different than today, and we're planning for, as best we can, with the information that we have, valid information, plans and programs for tomorrow. Thank you.
Yeah, of course.
I'm not in a position to actually decide whether or not all the schools in Nassau are closed, but I just wanted to address an issue with regard to something that Dr. Eisenstein had said. We're not just sending kids home and saying, good luck, parents. What we're trying to do is to create meaningful connections with these kids so that during the time that they would normally be in school, there will be opportunities for them not just to continue working with things that we have sent home to them, but stay connected with us in the school. We need to work with families. So part of that is that kids are not just going to be sitting there with their parents kind of twiddling their thumbs and wondering what to do, as they do many times on a snow day. We really want to make sure that there is this meaningful opportunity for them to reconnect with us, and during the period of time that they would normally be in school, are in fact given the opportunity to continue their work on school-related activities. So again, we've tried to think that through, and getting to the issue that was, I guess, the underlying issue is, what happens when all of these kids, are they going to the mall? No, I would hope that they're not. But part of that is what we are able to do as a school system in providing meaningful activities for these kids to be involved in on a regular basis. So, thank you.
You know, one thing I'll add, and then I'll take your question, Sophia, is, as parents, we know that children are emotional sponges. They're looking for us to see how to feel about certain things. So if we're panicked and we're stressing out and we're, driving ourselves crazy, they absorb that and they'll feel that way too. So I think another way we can protect our kids, take that deep breath, stay calm, tell them the facts in an age-appropriate way, and then just tell them the truth. Everything is going to be okay. We're going to be fine. And I think that will go a very long way as well. Sophia.
That was kind of my question. So one of my kindergarten son's classmates is in isolation. And I said, what about the psychological? Like, what do you tell your kids if you're forced to be in the house for 2 weeks with them and, taking their temperature and all this other, what do you say to them so they don't think they're dying? Because, some adults are panicking right now, let alone little kids.
You have advice, doctor?
Yeah, I have teenagers who are quite astute too, and you do notice they read the papers. I think the rumors that was such an important point, and especially now at the health department, we're spending so much time trying to get proper information out. And sometimes you hear something and you want to know, how come we haven't heard anything from the health department? We have to make sure that the information we're providing is accurate. I think when parents look, I just told you the fact that no children have died from this, and that's something I said to my younger daughter, and you could just see a sense of relief when you take the information. Of course, she then said, what about parents? And I said, well, your parents are healthy and are not in the age that's typically suffering most from this. But I said, but this is why it's important to wash your hands. This is why it's important that if one of your friends is sick, just stay away from them. You don't want them to bring that. You're going to be fine. We don't want you to bring that home to us or one of our neighbors who's a senior citizen that visits a lot. I said, it's everybody's part to play. So I like to make them proactive in getting the message that they are helping this. We're not going to sit around and be victims, even for our children. Now, that's much more difficult for a kindergartner. But I think the message that the county executive said is really important. It will be okay. And I think the message that you heard from the superintendents that when a school gets closed, should it happen for an extended period of time, that it's a structured time, that there's guidance. There has to be guidance and structure as best as possible to contain a sense of normalcy. And all of their friends are going to be out of school too. All of their friends and classmates are going to be dealing with it. And if the messaging is done right, I try and instill in people that we educate, let's make it a positive thing. Let's make the kids part of learning that they have to wash their hands. This is why I drive my kids crazy. Wash your hands. Don't touch your face. Now's the time that all those years of us saying that comes into play where you can save people's lives. And I think when you turn it into a positive message with the understanding that this is because there is an illness, but everybody can be part of preventing the illness. And I really believe that that makes a difference in the way kids will respond to it. I'm not a therapist, and I'm not an educator, but I'm a parent, and I do notice changes among them. They read the news. The worst thing, though, are the rumors. The rumors of, oh my, we've been very upfront with our information. We announced that there were 2 school bus drivers that are tested positive. And I can't tell you how many calls the health department got. Which kid is it in those schools? That's the reason the school closed. We told you it was because of a bus driver, no kids. And, you know, that's the kind of rumor that really changes the way people handle it. So please, let us give you the proper information. We've been doing so many events to give proper information, and we'll keep doing that.
We got a concern from a parent. I guess there's a large dance competition this weekend in Nassau County. The parent is concerned that this should not be going on. It should be canceled. Does the county ever get involved or plans to get involved in these sort of large gatherings that are planned?
I don't know anything about this particular dance competition. I do know my own personal calendar, things are flying off. Kiwanis, all kinds of events are just not happening. I think a lot of people are, especially when it comes to kids and other social events, especially, well, actually even more for seniors, things are being canceled.
They're saying absolutely this competition is happening this weekend. No ifs, ands, or buts. Is that something that the county gets involved in, or is that the organizer's decision and that's what they're going to do?
So let me answer your question and then give what the guidance is. To answer your question, if there's a circumstance that we consider an imminent public health threat, by all means the county will get involved. But there's also guidance from the CDC and the state. And right now the guidance is for people who may be senior citizens or may have an underlying health risk to avoid large gatherings. In that case, if we have a school building or community that's considered a cluster, in other words, what's happening in Westchester, an event like that isn't going to happen within that zone in New Rochelle. But it is up to private business, and dance competitions are private businesses, to make a determination, and there may be measures that they could take. For example, I have daughters who dance. Maybe to avoid large gatherings, they just limit it to soloists. So there aren't large gatherings, and you don't have large numbers of people. There are things that can be done to mitigate it. If there's a real outright large cluster, absolutely, and there's an immediate danger, the health department will get involved. But even now, you know, you've heard of this question's come up with sporting events, and the businesses make their own decision with our guidance. But it's really up to each individual to determine what is their risk, what measures are they able to take to be safe if they go to one of these events. And I think that that's the guidance from the CDC is the most important thing for people to check. They could go to the CDC's website as often as they want. It's updated very frequently, and it provides that kind of guidance for every aspect of society, for healthcare providers, for colleges and universities, for citizens, for clergy, for police, EMS, responders. So I think I said a lot. I don't know if I answered it, but thank you. Yeah.
One of the superintendents asked a question. You talked about e-learning, tele-learning. Will that be a decision made on a district-by-district basis, or will state ed tell you we need to do this? Because I know the individual colleges are making that decision. How will it work with the 56 school districts?
Each school district has to make a decision on its own, and It will depend on their capacity to provide that type of e-learning, and I will tell you that there's a wide variation in capability of doing that, but I can tell you that every school district in Nassau County, as we are speaking now, are contemplating some form of maintaining connection with the children that ultimately may end up being. I'm not sure exactly what it will look differently in every community, but every community is, and every school district, to my knowledge, is in fact working on plans to engage their kids during a period, if this should happen, of extended separation.
Just to follow up on that, as these plans are developed, and as Bill said, there's a wide range, a continuum of capacity and ability on the districts and the students and families in the districts. We will be reporting up to the State Education Department what we can actually do and how that will be evaluated, not only here in Long Island, but through other parts of the state. So there's more to come on that, and we're planning, as I said, we're in a good spot here in Nassau County, and that'll be compared and contrasted with what the state has and what the state puts in its regulations.
There are specific criteria. What you just said is one of the criteria. So if you've returned from one of the 5 countries and you're not sick, you're in voluntary isolation. If you've returned from one of those countries and you are sick, you're in mandatory isolation. If there's certain degrees of contact, that would put you into voluntary isolation, and so there's a whole categorized list of what's voluntary and what's mandatory. And precautionary is essentially the guidance changed last week, and what we were calling voluntary is now being called precautionary. That is one of the reasons, but not all of the reasons. It depends on an exposure that was not a direct exposure, what's called proximate. So if you've come in close contact with somebody who's positive, say within 6 feet, or they're a family member, that's direct contact. But you and I right now are in proximate contact. So if one of us had it, I'm choosing you, I right now would be voluntary because of our proximate distance, okay? Thank you.
Thank you.